Today we're going to be talking about electric toothbrushes and irrigators. So the definition of an electric toothbrush is a toothbrush that has a motor and vibrates or moves the head. Clients have a high acceptance for the electric toothbrushes, and they have been shown to be safe and effective. A power toothbrush is useful for basically any client. A little bit of the history of the electric toothbrush. It dates back to 1954 in Switzerland, where Dr. Philip Wong invented the first usable electric toothbrush. This electric toothbrush was later sold in the US under the name Broxident. Some of the brands and price points of the electric toothbrush range anywhere from $24.99 on the low end to $249.99 on the high end. These toothbrushes can be purchased at stores such as Zehrs, Walmart, Shoppers, or online at Amazon.com. Some comparisons between Sonicare and Oral-B, as they are two of the most popular brands. Each product has its own benefits and appeals to certain personal preferences. There was a 6-week clinical trial completed by Oral-B, comparing the Oral-B Pro 7000 with the Sonicare Diamond Clean, which are both the top-of-the-line brushes for each manufacturer. There is a bit of a bias, given that Oral-B conducted this clinical study. However, Oral-B did conclude that Oral-B Pro 7000 removes 22% more plaque, is 32% better at improving gum health, and 33% better in hard-to-reach places for an overall clean compared to the Sonicare Diamond Clean. A second case study was a 6-month clinical study completed between, again, Sonicare and the Oral-B oscillating electric toothbrush. The factors tested during this case study were removing supragingival plaque, reducing gingival inflammation, reducing probing pocket depth, and improving probing attachment levels. In conclusion, after the study was complete, both brushes did improve periodontal health in adult periodontitis clients. However, the Sonicare brush was superior to the Oral-B brush in reducing gingival inflammation, probing depth, and improving probing attachment levels. Some recommendations: both brushes were great at successfully removing plaque when used regularly. Things that come down to personal preference include, for Oral-B, the oscillating brush head, and then Sonicare does have 31,000 movements per minute. Both are great for everyday usage. However, if you are looking for something to help with your periodontal conditions, Sonicare would be the way to go.
There are many different marketing strategies for electric toothbrushes, such as radio, TV, and print advertisements. These advertisements focus on cosmetic benefit instead of therapeutic, and they often have attractive actors and greatly emphasize their looks. They also show off the power that the toothbrush has. So here's a TV commercial for electric toothbrushes.
I asked my dentist if an electric toothbrush was going to clean better than a manual. He said sure, but don't get just any one. Get one inspired by dentists, with a round brush head.
Go pro with Oral-B. Oral-B's rounded brush head cups your teeth to break up plaque and rotates to sweep it away. And Oral-B delivers a clinically proven superior clean versus Sonicare Diamond Clean.
My mouth feels super clean.
Oral-B. Know you're getting a superior clean.
I'm never going back to a manual brush.
Here are some print ads for electric toothbrushes, just explaining their benefits. The target audience is everyone who uses a toothbrush and for those who want clean gums and teeth. They're also for children who want to make brushing more fun and adults who want to know more facts. Here's just a demo on how to use an electric toothbrush. And remember to brush for 2 minutes, spending equal amount of time on each part of the mouth.
Oral-B oscillating rotating brushing instructions. Wet brush head and apply toothpaste. You can use any kind of toothpaste. To avoid splashing, guide the brush head to your teeth before switching on the appliance. Move the brush head slowly from tooth to tooth along the gum line, spending a few seconds on each tooth surface. Brush the gums as well as the teeth. First the outsides. Incline the brush head so the bristles could reach interdental areas. Then the insides. And finally, the chewing surfaces. There is no need to brush hard or scrub. Let the brush do the work. More advanced models of Oral-B power brushes have a gum care pressure control system that alerts you when brushing too hard.
Okay, so on to oral irrigators. Oral irrigators are one of the dental hygiene aids to enhance and improve the effectiveness of plaque control and gingival health. The Common oral irrigators have a motor with a pump, a water reservoir, and a special tip such as the jet tip or a standard tip. Okay, so for brand names, it includes Waterpik, Profloss, Panasonic, Philips, and Oral-B. Clients can purchase these oral irrigators at Zehrs, Walmart, Shoppers, or online such as Amazon. The price points for these brands range from $13.99 to $98.86. In comparison, we compared Waterpik and Philips. Both products have the option to use mouthwash or any antibacterial like chlorhexidine. For Waterpik, it is stream of water and it is less expensive and more effective. And for Philips, it is stream of water, less messy, easy to use, and with no hose. So the purpose of the case study was to compare the reduction of plaque and gingival bleeding between the water flosser or an interdental brush, both combined with a manual toothbrush. There was 28 volunteer participants in the 2-week study. There were 2 groups, one using the Waterpik flosser with a manual toothbrush, and the other was using an interdental brush and manual toothbrush. Bleeding on probing was measured at 6 sites and was reported for the whole mouth, lingual, facial, mesial, and distal. Plaque data was measured using the Rastogi modification of the Navy Plaque Index, RMNPI, and were reported for the whole mouth, at proximal, marginal, facial, and lingual areas. Both groups were given instructions on how to use each oral healthcare aid properly. At the end of the 2-week study, both groups had a reduction in bleeding and probing on RMNPI. However, the water flosser was overall more effective by 53% than the interdental brush. Therefore, the water flosser is more effective than the interdental brush for reducing gingival bleeding. Marketing, there's internet ads, TV commercials, and dental offices. This is a TV commercial.
Fumbling with your string floss? It's a hassle, but just brushing your teeth is not enough. You leave behind food particles and ugly plaque that can cause bad breath, tooth decay, and gum disease. Now there's a solution. This is the revolutionary new Waterpik Water Flosser, the easiest and most effective way to floss. Water flossing is so easy. Just point the flosser tip between your teeth and along the gum line and let it do all the work for you. Brushing, even with an electric toothbrush, only gets the surface. But the Waterpik Water Flosser cleans the areas brushing misses. You can have healthier gums and brighter teeth in just a minute a day.
Order now to...
So the target audience are clients with orthodontic appliances, implants, crown and bridges, periodontal maintenance, and clients with poor dexterity. This is a video demonstrating on how to use a water irrigator.
For your first use, you will need to prime the pump. Fill the reservoir with warm water and replace it firmly on the base. Select the tip that's right for you. Our customized tips are perfect for cleaning around braces, implants, and other dental work. Insert the tip firmly into the handle until it clicks into place. Turn the pressure setting to high. Point the tip into the sink. Turn power and water switches on until water flows. Turn unit off. To start water flossing, turn pressure to lowest setting. Place the tip into your mouth, lean over the sink, and turn the power and water switches on. Turn up to the pressure setting that feels most comfortable to you. As you floss, close your lips enough to prevent splashing but still allow water to run freely from your mouth into the sink. To avoid mess, don't look in the mirror while water flossing, look into the sink. Use the water on-off switch on the handle to temporarily stop the water flow if needed. For best results, aim the tip at the gum line at a 90-degree angle. Starting with the back teeth, follow the gum line and pause briefly between teeth. After completing the front side, spin the tip around and clean the back side in the same way. Once you finish flossing,
Thanks for watching!